You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Dennis Wells. Dr. Wells is the founder of the Nashville Center for Aesthetic Dentistry. We've invited Dr. Wells on the program today to discuss what you need to know if you are considering any type of cosmetic dentistry. Dr. Wells, welcome to the program.
Thanks, Randy. Pleasure to be here.
Before we get into today's topic, tell us a little bit about your practice. What type of patients do you see?
Well, we see patients of all varieties, from young to old. And we're very blessed. We see a lot of high-profile people in our community, and I think there's a mistaken idea that that's the only type of patient we see. And the fact of the matter is, though we're very honored that we have those type, very visible people, we really enjoy treating the day-to-day people, the businessman, the housewife, anybody who just wants to look better and feel better.
Now, you were the featured dentist on ABC, the national show, ABC's Extreme Makeover. How'd you get that?
I was one of the featured dentists, and it was interesting. Dr. Bill Dorfman did the lion's share of those programs, and he's a good friend of mine.
We've had him on the show.
Yes, he's been a part of the show. And as a matter of fact, when the producers were ready to add more dentists to that program, they asked Dr. Dorfman for some references, and we were fortunately one of the ones that he suggested.
Now, you teach other dentists cosmetic dentistry. What is it you're teaching them?
Well, recently, in the last 2 years, we've been teaching dentists about Durathin veneers, which is a prepless veneer that I'm so excited about.
Durathin, what is Durathin?
Well, Durathin is a name that we trademark, and it simply means a super thin veneer that we don't have to prepare the tooth. That's a big, big thing.
So it just goes over the tooth?
That's right. And we use it in cases where we can augment the size of the teeth, make them just a tiny bit bigger, and give more presence and give more wow to the smile.
You say it changes people's lives, changing their smile.
It can change their life, for sure. There have been cases we have done through the years that we've received letters. In fact, I have a whole collection book of letters of people who have written and just said some amazing things about how their world is so different and how their lives are so different. And of course, that just propels us to do that much more and to be that much better at what we're doing. But many times, it's not so life-changing and dramatic as that, but one thing's for certain, it is definitely appearance changing.
Okay.
Can I show you a case to
Sure.
show that? Take a look at this person, for example.
Very pretty.
Yeah, she's a lovely lady, and she comes to me, and in fact, she has a very high visible job. She's out in the public a lot, and she is so pretty that she's able to pull off the smile, which if you really look at it carefully is quite compromised. She had some old dentistry done years ago where some big kind of fat veneers were done that we've all seen that we know are not so great. So if you look at her smile, she has what we call a narrow arch. In other words, there's only a few front teeth that really are visible when she smiles, and you don't really get the sense of a smile that flows all the way back to the back of her mouth. So this is something that we routinely can change and really beautify the whole look by widening the arch.
Now, that's a pretty good looking smile, but she didn't like it.
She definitely did not like it. She comes to us and wondered, you know, what can we do and how conservatively can we change this into something that we're really going to like? And the great news is we were able to do very minimal aggressive dentistry here. In fact, we only had to prepare the 2 big teeth, and the rest of it we did without any preparation at all.
So what were her options? What'd you do?
We did a total of 8 porcelain veneers for her, and as I said, we only had to drill on 2 of the teeth to accomplish that. The rest of her smile needed more presence. It needed to be widened. It needed augmentation. So we were able to deliver that with 8 porcelain veneers, and the transformation was pretty profound. So let's take a look at the afters.
Beautiful.
A very profound change for this lady. You know, she's a beautiful young woman.
Looks like a model.
But now she's stunning. She really is, and she just glows. She has just told me of all the stories of people that she meets, even perfect strangers who will tell her how beautiful her smile is. She's never heard that before in her life. So very gratifying to help this lady and to do it very conservatively.
Now, if I saw her walking down the street, I wouldn't say, okay, look, you know, she's got a great, you know, veneers. They look very natural. They're not big. And you're saying a lot of these were these Durathins.
Absolutely. Yes, the majority of the cases I do today have little to no preparation on them. We're really, really big on trying to be conservative. And just like medicine has gone to more minimally invasive approaches on most anything, that's the trend in dentistry right now, and it's very exciting. Let me show you another case. This is another young lady that's very beautiful, and again, the things here that are compromised in her smile are not that magnificent. They're definitely
nice
not.
smile to begin with.
Yeah, a lot of people would love to have the smile, in fact. But she was not happy and knew there could be more, knew there could be more presence. A lot of her friends had porcelain veneers, and she longed for just a little more beauty and a little more glamour right there in
As
her teeth.
a dentist, when you look at her smile, what do you see?
You know, the first things we see obviously is that the teeth are a little small. There's some spaces, and most people do not like to have spaces between their teeth. And in fact, the spaces create not only small looking teeth, but they create a darkness there that even if you bleach the teeth vigorously, they still don't have the presence as when the spaces are not there. So our treatment plan was to simply try to enlarge her teeth just a bit and give a little more brightness and whiteness. And we were able to do that, again, with 8 porcelain veneers.
8.
8. And again, the great news here is we did not do any drilling or preparation on her teeth.
So putting the Durathin.
Absolutely. We're using Durathin veneers.
Right over those.
Right over her teeth. And we do this with a designing process. And instead of calling the intermittent restorations temporaries, we like to call them or refer to them as prototypes.
Okay.
Because we're literally going to design something that she's going to test drive for a few weeks and determine, her and me are going to determine that we really love this and that this is the architecture that we want our ceramics to duplicate.
With her after, moving on to her after.
Yeah, take a look at this after.
Beautiful.
A beautiful end result here.
Well, she looks like a beautiful woman now. She looked like a kid before.
Yes.
In a way, she becomes
Yes.
more sophisticated
Yes.
with just her smile.
And she has a more glamorous look. In fact, her words to me was, you know, I almost feel like I have the glamour smile now, that when I go to parties and things like that, I have, she said, I used to have kind of the everyday pretty smile, now I have a glam smile.
Now, when you're looking for a cosmetic dentist, what should you look for? I mean, should you directly go to the before and afters? Do you ask about their training? Because it seems very confusing.
It's a difficult.
And what do you ask?
It's a difficult task, and I get asked this a lot. You know, how do you pick a cosmetic dentist?
Yeah.
And you know, I think if I were in that position myself, and in fact I am, and in fact I have temporaries in my mouth right now.
Temporaries. Those
Yes.
aren't your teeth right now.
These are temporaries, they're prototypes, and so it's a testament that, you know, they can be very.
Can you eat with them?
I can eat, yes. I can. I have been eating. I hadn't stopped eating, and you can smile and feel confident about it even in the temporary stage. Back to your question, how do you choose a cosmetic dentist? I think you really need to look at their work and look at it carefully, and you need to try to look at their credentials and look at their training and their background. It's pretty clear to me when somebody is really focused on something and when they're dedicated and are passionate about their work, and I think that's the main requirement you're going to look for.
Now, you teach dentists all over the country. Do you? I mean, that's hard to teach, the art of it.
Yes.
I mean, some people have, I mean, do you ever feel that way? Some people have it, some people don't?
Well, I do get a little sense of that.
Without being negative, I guess.
Yes. I mean, there are a lot of artistic dentists in this country, and even in my community, there's a lot of artistic dentists. So it's certainly not a rarity. But there is a certain amount of innate skill that I think people have. There's some aptitude there that you just kind of are bent to do. And you want to look for people who have that. And I'll tell you, one of the biggest signs is that they just love it. They're passionate about it. They spend their time in continuing education. It's what they do every day.
Why do you like it so much?
Well, I like it because, number one, it's just so much fun to me. I really, really have fun doing this. It's exciting. And then a surprise to me as a dentist. When I was going through dental school, if somebody had told me one of the biggest joys you're going to have in your life is watching people transform, and they're going to send you presents and gifts, and they're going to thank you repeatedly and shed tears of joy. I could have not even imagined that, but that truly is one of the greatest things about what I do.
You see tears? Oftentimes, I mean, they look at their teeth in the mirror for the first time.
I do see that, and it's very moving. Even after doing this, I've been practicing dentistry a long time. This will be my 25th year. And you know, I still, not only me, but my team as well, we really, really get moved by the power of what we can do for somebody.
We're going to take a quick break. We come back. More about the process, what somebody can expect when they go in, what happens on day one, how you design the smile, and more of your before and afters. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Wells, cosmetic dentist, and we'll be right back.